and primarily because we have been listening about the data all this morning. And the second part was that who generates the data? But in this session, we are basically trying to see what data was actually generated. So initially it was the introduction of the data, and in this session, it is actually the data that we are going to discuss. Okay, so we have generated quite a significant amount of evidence under D4D, and this session is devoted exclusively for this. And for this, we have at least 5 partners from the academia. So initially, we have been hearing about the significance of the link between academia and policy, and here we are seeing this actually link on display. So the 4 educational institutions are working as the partners of UNFPA and STPI, which include IBA and Foreman Christian College University, NUST, University of Peshawar, and BUTEMS from Quetta. So the studies that have been prepared under this D4D, you might like to look at them at the end, at the back. They are displayed, and we are going to have discussion about them exactly in a while. So what we actually are going to achieve is to listen to the major takeaways from these reports and these, that a lot of effort has been devoted to this thing. And we would like to see the wealth of information that has been generated as a part of this exercise. So first of all, I would like to invite Mela from UNFPA. And she is from, she's Family Planning Advisor. So may I request Mela, please? Thanks a lot. Anywhere you like. Thank you. Okay, and apart from this, next are our guests. The first guest is Ms. Aruj Wahid Dar. Please, Senior Research Associate, STPI, please. Take a seat. Anywhere you like. Next is Dr. Masood A. Siddiq, Senior Research Macro Policy, PRAC from Karachi. Please welcome Dr. Masood. And our next a highly learned guest is Dr. Waqas Ali, Associate Professor from Foreman Christian College, University, Lahore. Please welcome him. And our next guest is Dr. Faisal Abbas. He's HOD, Department of Economics, NUST, Islamabad. Okay. Dr. Akhtar Ali, please, officiating on the part of Dr. Faisal Abbas. And Dr. S.M. Nabilul Haq, Assistant Professor, BUTEMS, Quetta. Please welcome him. And our final guest is Dr. Muhammad Iqbal, Assistant Professor, University of Peshawar. Please welcome him. Please, no more chairs, please. Okay, so please, this is your turn, please. Come here and please. Okay, thank you.
I have to take on this step, otherwise you will not see me. Okay, thank you. Bismillahirrahmanirrahim. Good afternoon. Assalamualaikum, everyone, ladies and gentlemen, distinguished panelists, and the chief guest. Mukadar and Sajid. Thank you for having me this afternoon. It's my great pleasure to be with you in this very important session. And it's my pleasure to address this session. So we gather here not just simply to talk about or discuss reports or working papers, but to reflect on something that far more profound, to transform or the transformation from raw data into knowledge that guides the policy that shape the lives. So because at its core, it's not about only about data, but it is about choices, priorities, and lives. I believe all of us here agree that Pakistan is not suffering from a lack of data. We are grappling with more complex issue or more that are more consequential. It's not about lack of data, but whether the data or evidence that we have truly matters, and which evidence that matters, and whether those evidence are able to be translated into good policy. And most importantly, to whom does it matter? So the Data for Development Initiative has helped Pakistan move decisively from data scarcity to data abundance. Now we have many reports, surveys, platforms, what else? Portals, digital platforms that maybe a decade ago are nothing, are not there. So we have now all of those these days, and thanks to the D4D. What D4D has enabled is not only to have a better data, to produce better data, but it also helped create an ecosystem where statistics evolve into insights, and insights inform policy, and policy translate into improved lives. Now, let us pause and ask a big question here. Have our knowledge product, the evidence or the data, shaping real decision? For example, have they influenced the budget allocation or improve program design or influence legislative reforms or strengthen accountability mechanism? Evidence matter only when it is decision relevant, timely, trusted, and actionable. So going back to the title of this session this afternoon, what makes evidence matter? This is our topic of this afternoon. Let me take this opportunity to suggest 4 characteristics of what makes evidence matter. 4 characteristics that turn data into evidence that matters. The first characteristic is evidence that is people-centered. At UNFPA, we often say behind every number is a person. But let's also say, I think it's also relevant to say that behind every average are inequalities. Evidence matters when it reveals who is being left behind. For example, girls drop out before secondary school, young people that are not in school, neither in employment nor in training, or women with unmet need for family planning, who they are, where they are, and why they have this unmet need, or district that on paper have all the services, but in reality, it's not there. So the knowledge product that the D4D initiative produced help make this invisible population visible. The second characteristic that I'm proposing is that the evidence that is policy ready. So the policy maker do not need tables, figures, or graphs. They need choices that are framed clearly, without complication of technicalities of the data. This is where working papers, policy briefs, and synthesis products need to showcase the issue, translate complexity into options, not as prescriptions, and respecting the ownership of the decision maker, also strengthening the decision quality. The third characteristic is evidence that is trusted and institutionalized. Evidence matters when it is produced through credible institution, governed by clear standards, and embedded in official system. And lastly, the characteristic that I would like to propose is evidence that is used across sectors. Population data is not only for population department. Youth data is not only for Minister of Youth, or gender data is not only for Women's Commission. So evidence matter when it travels across sectors. So I think the greatest achievement of this D4D initiative is not only having portals or index or a report, but if we can transform the data, the information, the evidence emerge from the knowledge product to knowledge culture, where the officers will ask for evidence before they approving plans. Or maybe provinces compare their results without competition, but rather in a more constructive way. And youth are not just subject of data, but also the users of the data. And evidence becomes a shared language across government and partners. Of course, this culture does not emerge overnight. It requires leadership, incentives, and continued investment. Now, as we will reflect from the panelists this afternoon, let me also suggest calls for action for all of us. Let's also build a culture of designing the evidence backward. Start with the policy question, and then ask what evidence that we need. Let's also invest as much in use as in production. And let's protect evidence as a public good. At the end, let me close my remarks by saying that the future of Pakistan will not shape by the volume of data we produce, but by the wisdom with which we use it. We at UNFPA remains deeply committed to walking this journey together with all of you in partnership, in humility, and with unwavering belief in the power of evidence to advance right, equity, and dignity for all. Thank you.
Thanks a lot. We truly appreciate the thoughtful and insightful comments of Mela. Obviously, she had a point when she said that the lack of data is not the real issue in Pakistan. It is how the translation of that data into the policy that is a gap that needs to be bridged. So, and and definitely there are several other gems of wisdom, and one of which that was truly remarkable was behind every average is inequalities. So she can't be more true. There are so many outliers that are simply subsumed in the averages. Okay, from now on, first I would like to introduce the chief guest of the session, which is Muhammad Ali Talpur. He is Joint Chief Economist, Ministry of Planning, Development and Special Initiatives, and we hope to listen to him at the end of the session. And now we move on to the next presentation, comments by Ms. Zahra Jabin, Program Analyst, Adolescent and Youth, UNFPA. Please welcome Zahra Jabin.
Thank you very much. I think on behalf of UNFPA, Mela has said a lot, and it would be unfair if I say more because she's done it in a wonderful manner and she's covered pretty much everything that I wanted to say. But just to kind of emphasize on the youth and adolescent part of the data and the research and evidence when we talk about. For UNFPA, adolescents and youth are always at the center of development, and which is why when we see an opportunity of gathering data, of collecting evidence, we try to focus on those groups which are normally unnoticed. So this year, with respect to adolescent and youth, and I think Aruj and other colleagues will talk about it, but we have conducted a comprehensive study on out-of-school children. With 25 million children still out of school, I think it's very important that we focus on that particular population and see that if they're out of school, what is it that they're doing? We know that the girls who are out of school are usually pushed into the menace of early child marriage. The boys who don't get to attend school are also a victim of child labor. So it was very important for us to look into what is it that the out-of-school adolescents need and how can we integrate them, and how can we make our programming and policies more inclusive by also thinking about all those people who do not have access to education. So that's one thing that we'll be talking more about in this particular session. The other thing that we are speaking about since morning is young people. And we all know the stats, and I don't need to repeat the number of young people that are living in Pakistan and how it's going to shape our future, at least next 10 to 20 years. Normally, when we talk about young people, we think about these common indicators. What is the education status? Are they employed? Are they unemployed? Are they migrating? Do they have access to health services? But do we really talk about how many of them are going through mental health issues? Do they have access to psychosocial support services? Do they have access to information on sexual reproductive health? Do they have access to facilities where SRH services are provided in a confidential manner? So that's the second part of our study today, that we also took a deep dive into understanding the situation of SRH in country with respect to young people. And I will rely on the colleagues in the panel to talk more about it, but just to re-emphasize that when we talk about sexual reproductive health rights, we must remember that young people's mental health, decision-making, and opportunities are directly connected to their health and well-being. So again, to close, I would just say that when we listen to these findings today, we must also question, are we doing enough to support the young people and adolescents of the country the way they want to be supported? And I think that reflection needs to be translated into policy as well as into action. Thank you very much.
Thanks a lot, Zahra Jabin, for your very insightful comments. especially about the psychological health and their critical significance for their overall well-being. Now, we are going to start the next phase of this event with the findings of our guests who have authored these reports that you can see, and they will be presented here, of course, in front of you. And here are some suggestions that because you have done painstaking work, spanning lots and lots of times in months and years. So we would like to see the takeaways, especially the takeaways that you would like the policymakers and the decision makers to listen. And maybe you would like to skip some of the technical details, but you might like to focus on your major findings and how they could be translated into better policies. So we start with our first guest, Ms. Rooj Wahid Dar, Senior Research Associate at SDPI. तो यहाँ पे आना चाहिए? Okay, please.
Assalamu alaikum everyone. I'm Arooj and I will be presenting findings from the needs assessment of out-of-school adolescents and youth with focus on Punjab and KP. So if we can have the slides. So basically the study was conducted in collaboration between SDPI and UNFPA, and the study focuses on assessing the needs of out-of-school adolescents and youth, that is individuals between the ages of 10 to 29. Now there's a lot of focus on out-of-school children in policy, but when we talk about youth that has not had access to proper schooling when they were of school-going age, there's very little focus. So what this study aims to do is it aims to mainstream those individuals that have probably crossed the school-going age. What kind of support can be offered to them at this point to sort of ensure their reintegration into better health, education, engagement, and employment opportunities? So this is the conceptual framework of the study. There are two main streams. Either individuals have access to proper schooling, which allows them better access to education, employment, health, and engagement opportunities. But there's another group of individuals that are faced with demand and supply side barriers. These individuals are either never enrolled into schools or they are forced to drop out of schools. As a result, they are faced with child labor, they're faced with early marriage, they're faced with indecent employment, and lots of other poor results. Now, what we theorize is that if targeted support is provided to these individuals, they can also have access to some of those better health, education, engagement, and health opportunities. Next slide, please. So the latest census results show us that within the youth population, that is individuals between the ages of 15 to 29, a whopping 63% has never been to school. And this does not include those that have dropped out of school. This percentage is only representing those that have never ever been enrolled in schools. And within the adolescent population, it is close to 25%. So because of these huge numbers, it is important to look at out-of-school adolescents and youth as a separate demographic, which needs very focused interest from policymakers so that targeted support can be provided to them to support their integration. Next slide, please. So for this study, we focused on two provinces, Punjab and KP, 4 districts in Punjab and 3 districts in KP. And to ensure representation, we sampled districts with varied human development index. A mixed methods approach was employed in which we conducted nearly 1,500 household surveys, and these were complemented by life history interviews as well as FGDs. Within each district, 6 FGDs were conducted with parents of out-of-school adolescents and youth, employers of out-of-school adolescents and youth, peers of out-of-school adolescents and youth, and out-of-school adolescents and youth themselves. And gender segregation was also ensured within those groups to ensure that people talked openly about what they feel. Next slide, please. So what do you think are some of the main barriers to school access? If I can ask the audience, what do you think are some of the most major barriers to school access? Yes? Poverty, yes. Anything else? Accessibility in terms of transportation, unavailability of schools, what else? Cultural barriers are also there. Next slide, please. So here you can see some of the most major barriers to school access. And as many of you guessed right, financial struggle is the most significant barrier to school access. Nearly 75% of our respondents, that's 3 out of every 4 respondents, reported that they dropped out of school because of financial issues. These are complemented by transportation issues, cultural issues, fear of harassment issues, all of which are more binding for females compared to males. Next slide, please. Now, what are some of the impacts of remaining out of school? Next slide. Now, what we see is that there is an intergenerational impact of remaining out of school, meaning that if today a child is out of school, chances are that tomorrow they will not have access to proper employment. So they will be stuck in a cycle of poverty where their own children tomorrow will not be able to access school. So there is this intergenerational cycle of remaining out of school. Another outcome is the gendered outcome. As Zara also briefly mentioned, boys are forced into child labor and girls are forced either to perform household chores, unpaid care activities, or they're forced into early marriages. Now you can see over here that nearly half the male respondents said that they are out of school because they are forced into child labor. Also, nearly 2/3 of the male respondents said that they felt pressured into starting earning early. Within the girls, nearly 45% reported that they remain out of school due to domestic work. And within our sample, the median age of marriage was 18, and that is the minimum legal age of marriage. So you can well imagine almost half the sample either got married at 18 or below. Next slide, please. Within education and learning, foundational literacy was extremely low, with less than 1/3 being able to comfortably read simple text. Only 45% can perform basic mathematics. And this is very, very basic addition and subtraction. For example, calculating change, counting money. So only 45% of the respondents were able to perform basic math. In terms of alternative learning opportunities, more than 90% of the respondents said that they had never attended any skills development program or any training program. Only 25% had attended madrasas. Nearly 13% had pursued apprenticeships, but these were largely informal, so there was no proper certification for these. And around 15% had relied on home-based learnings, comprising mainly women who had learned basic stitching, cooking, baking at home. Next, please. Within health, 70% of our sample said that they were unable to afford health services due to unaffordability issues, and 62% were unable to access health facilities because of transportation issues. Due to unaffordability and financial issues that these individuals face, nearly 3/4 rely on public hospitals. Now, you can well imagine that in districts where there are no public hospitals or the public hospitals themselves are poorly equipped, these individuals have very low access to health. Due to this, there is widespread malnutrition and mental distress also. 2 out of every 5 respondents showed signs of mental distress, including anxiety, sleeplessness, lack of interest, and 7.2% recognize a need for mental health counseling, largely due to stigma. Only 6.1% reported that they had access to mental health facilities in the health facility nearest to them. And a whopping 82.5% of the married youth that have never been to school have never received SRH or family planning services. Just let that sink in.
May I request you to please conclude?
Let me just quickly pass through the remaining. Within employment, 75% lack access to paid employment, and this includes 95% of our female sample. Gender norms restrict female opportunities where majority of them are stuck performing household chores where they are not paid anything. More than half the sample earn less than 25,000 rupees per month, which is way below the minimum age. And 42% rely on daily wages. Next. So these are some of the common professions which these out-of-school adolescents and youth are stuck in. Next, please. So what do they need? In their own voices, they need vocational training and skills development program. But those are already being offered. So what do we need to do differently? We need to make them more accessible, we need to make them more flexible, and we need to ensure that whatever tools these out-of-school adolescents and youth need are provided to them within those programs. So because affordability is the major issue, we need to make sure that there are no costs associated with getting enrolled in these programs. Next slide, please. Within policy focus, we need to ensure that out-of-school adolescents and youth are recognized as a distinct demographic. They need to be mainstream within policy making and programmatic design. We need to strengthen the implementation of labor laws as well as the child labor laws because they are neither uniformly formed across provinces nor are they uniformly applied. We also need to map school availability and to ensure that ADB allocations go towards districts which have the lowest school availability. And we need to improve our data systems. Last slide, please. Within programmatic level interventions, we need to introduce bridging and re-enrollment programs for adolescents. And for youth that have already crossed the school-going age, we need to offer phased skills development program. And by phased learning, we mean that initially there should be foundational and basic learning, which should be followed by skills development. And within those programs, there should be sessions on SRH, GBV, family planning. All of those should be integrated within these programs. We need to strengthen our poverty reduction through better targeted conditional cash transfers. We need to provide interest-free loans and micro-grants to support work from home for women particularly. We need to offer job portals and employment facilitation via the district youth offices. So the district youth centers across districts in both provinces can be leveraged for this. We need to formalize apprenticeships through employer partnerships, and we need to strengthen community engagement through district-level youth centers. That's all from my side. Thank you.
Thanks a lot. Now our next speaker is Dr. Masood A. Siddiq, Senior Researcher, Macro Policy, PRAC, Karachi. Please welcome, sir.
Bismillah ar-Rahman Rahim. I'm Dr. Masood Siddiqui from PRC IBA Karachi, and I am going to present our work on, can you please switch it on, my first slide. I'm going to present my work on the determinants of fertility behaviors in Pakistan. That is our meta-analysis study. And as most of us know, that meta-analysis is a very rigorous policy method whenever there is a conflicting or mixed evidence about the impact of certain phenomena. So we used to combine the different evidence to come up with a strong, statistically strong combined effect. That is what the meta-analysis domain is for. And this was very common in medical sciences, and now it is very much adopted for the social sciences. So this is just a brief introduction of our work. This work is done by myself, Dr. Khatija Bari, who is head of the PRC IBA, and Ms. Nilma Faraz over here. So next slide. Why fertility determinants? What's the need of this meta-analysis? Whenever we talk about fertility determinants, there is a lot of debate among the policy researchers. What basically drives high fertility rates in Pakistan? There is on average, there is a consensus about many of the determinants that drives the fertility behaviors. But which determinant are important from the policy perspective? There is a very less consensus among the researchers. There are researchers that emphasize the supply side of the fertility determinants. There are policy researchers that emphasize the demand side of the determinants. So there is the evidence about what are the basic key drivers of fertility behaviors in Pakistan. The evidence is mixed in Pakistan. So with this objective, we aim to synthesize this fragmented and mixed evidence about what are the key fertility determinants that are responsible for such high fertility rates in Pakistan. And we adopted this methodology in order to synthesize this evidence. And what we aim for is an evidence-based policy recommendation. Next slide. As I just mentioned, that there is a lack of evidence among what are the key fertility determinants that drives the higher fertility rates in Pakistan. This lack of evidence has resulted in largely in a very poor policy response of population programs in Pakistan. Despite the fact, as you all know, Pakistan is having one of the oldest population control program in this region. It started back in 1965. And as you can see the figures over here, that we are right now having the highest total fertility rate in comparison to our South Asian counterparts. The fertility rate is the TFR, total fertility rate, which is average number of children per woman in reproductive age. It's around 3.9 in Pakistan, as you can see. The fertility rate has declined, but after 2005, as you can see in the data, it has just stagnated, and even after 2009, it is rising. What does this show? This shows that there is a serious issue with our population program policies. We need to look into that. Next, please. With this thing in mind, we sought to collect the overall empirical evidence about what are the key drivers of fertility determinants in Pakistan. And for this, we looked into the supply side arguments from the different studies, demand side arguments, as well as we looked into what is the evidence, what is the gap in the evidence that we need to look into. Our research objectives are multiple. First of all, we need to synthesize this fragmented evidence, as I just mentioned. Then we need to identify that despite a lot of debate about the demand side factor and supply side factor, what the data and the available evidence shows, what are the key elements that are mainly driving this high fertility rate and the high population growth rate in Pakistan. For this, we collected all the empirical evidence related to the question from 1968 to the latest data source 2023, I think. So this was around a sample size. Next, please. I won't go too much into the technical detail. We collected a sample size of around 65 studies. And when we applied our eligibility criteria to these studies, we were led to a final sample size of 30 studies. And we used the PRISMA method, which is a very standard preferential reporting of systematic review and meta-analysis method. I won't go into too much of the technical details. I would rather more focus on the key takeaways from our study. So this was a PRISMA method of reporting the study sample selection. And then we applied some meta-analysis techniques to our study sample. What was our outcome? I just request you to focus on these 3 target outcomes that I am just mentioning here: contraceptive use, fertility levels, fertility preferences. So on the whole, when we synthesized all the available evidence of the studies that have looked into the fertility determinants in Pakistan, we found that on average, these studies have looked into the effect of these 3 key outcomes. That what we call as fertility behaviors: contraceptive use, total fertility rate, and fertility preference for a son or a female child. So we reduced our sample into these 3 key outcomes on which we sought the impact of different determinants. This was a multi-level modeling. We opted for a multi-level meta-regression model. We used R, metaphor package for this. And then we applied this meta-analysis model to our final selected sample size, sample of studies. We collected the effects from all of this, the studies that we selected for our sample. And after applying our meta-analysis model, what we got? We got certain key findings. There are certain factors that have been very much emphasized, or very much, rather I would say, publicized in Pakistan as the key determinant of this high population growth rate and high fertility rate. Surprisingly, our results found these key determinants to be insignificant. For example, this is a general perception that if a female is working, she might have a small number of family. This evidence very much relevant when we study the European demographics. We see that when the Europe focused more on the female employment, there was a significant decline in their population. There was a significant decline in their total fertility rate. It was assumed that when a woman is working, she is assumed to have a very small number of kids. This evidence was insignificant in Pakistan. This is one of the first few interesting results of our meta-analysis. So we see...
May request you to please conclude it in
Okay.
a couple of minutes.
Okay,
We would like to listen to you for
Okay,
a lot of length
sure.
of time.
sure. So female employment was insignificant. Income and wealth, we found it to be a very significant indicator of these fertility behaviors that I just mentioned. It was having a significant level, as you can just see the numbers. I won't go into the detail. Family planning exposure, unfortunately, exposure to family planning program was found to be insignificant in our results. The pooled effect has a very high p-value, which shows that the family planning exposure programs are not very effective in driving these behaviors. Female age 30 plus was found to be a very strong indicator. It was highly significant. Female of older age are more prone to use contraceptives. They are more receptive to the population control methods. Female of younger age, they were more prone to have large family size and have more tendency to have more children. So this was another one of the interesting results of our meta-analysis. Similarly, we found son preference to be a very strong driving factor in Pakistan. People prefer son as a gender. And in their quest to have son and another son, they keep continuing with their family size. There were regional variations in heterogeneity. You can't say that a single policy program is a fit for all in Pakistan. some program that might work well in Sindh, or some program that might work well in rural area might not work well in Punjab or urban areas. So we found this regional heterogeneity and policy program impacts. So what are our policy recommendations? You need to have, in designing the policy, you need to have certain age targeted services, target more early age marriages, because our evidence has found that marriages of women having age more than 30 plus are more receptive to the population program policies. You need to have economic intervention because income and wealth variable was also significant in our study. So you need to focus on how much income people have to be able to buy the contraceptives, to be able to buy the modern population control methods. So you need to have, our policies need to have an economic focus as well. Then there has to be a very big question. There has to be some cultural reorientation about the son preference in our society. That is a very big question. Then we just designed some hypothetical resource allocation to certain high priority areas. I won't go into the details, as these are the proven drivers from our meta-analysis. So what we conclude is that any good policy program, a population control policy program, must have age-targeted services. They must focus on economic access, and they must have certain cultural and social policies that reduce the son preference issue that is driving the population high. Okay, so these are our conclusion, and our conclusion is not saying anything new. It's just the emphasis upon the three major drivers of high population and total fertility in Pakistan. Any good policy has to be a phased rollout program. There has to be rigorous monitoring and evaluation and quality of the system. There has to be a trained workforce to implement this type of program. And there has to be an innovation and scale. And finally, fit for all approach doesn't work in Pakistan. You have to design your family planning policies, which are very specific heterogenetically and which are very specific geographically. Thank you so much.
Thanks a lot, Dr. Masood, for a wonderful study and wonderful presentation and a lot of insights for the policymakers. Our next speaker is Dr. Waqas Ali, Associate Professor from FCCU Lahore. Please, welcome.
Thank you to the UNFPA and STPI and all of you for giving me this opportunity. My slides over here, please. So we basically started off with a very simple question. And that question was, why are family planning policies not translating into practice? Punjab has extensively worked on population control for the last 10 years. We have a new policy. There's the new policy coming in 2024. But the overall result on TFR is very minimal, especially in rural areas. So what we basically wanted to look at, we wanted to look at that missed reality that perhaps other researchers were not able to capture. So we went into qualitative research, and the evidence that we present today is basically a study that was conducted in 3 rural communities in South, Central, and North Punjab. We conducted 41 interviews and 6 FTGs. I'm getting the technical details out of the way so I can focus on key findings and perhaps some key takeaways. So I'll start with what we found in literature, and that is that the policies that have so far been made in Pakistan or Punjab specifically have certain assumptions. Assumption number 1 is uniformity of information. We just assume that everybody gets information about family planning policies. Assumption number 2 is when people get that information, they all understand it in similar ways. Assumption number 3 is decisions are rational, which means anybody who would be given this information, it would be just a rational decision for them to have less children. And last but not least, service availability means sustained contraceptive use, which means if you make contraceptives available, people will just have a sustained use of it. They'll keep on using it. They just need availability, which again goes back to the rational choice. idea. But what we observed in the field was, number one, men and women do not get the same information. They have different information channels, usually through social networks, and they're not getting the same type of information about family planning. When they get this information, the way they make sense of that information is different. Men make sense of this information differently as opposed to women. When decisions are made, they are made in the household context. And no matter what information you give to them, household contexts have their own norms, their own power structures. People have their own lived experiences, and those basically determine what choices people make in their lives. And lastly, contraceptive use is very fragile. A lot of people take it up, but then stop using contraception because they've had a bad experience and they were not ready for those bad experiences. So just making things available to people does not ensure that they will keep on using them. So this is basically about my study, which I'm going to skip. I'm going to focus on what we call the information pathway, like how does a decision about family planning is made in the household context. First, people have information sources, then they have some communication which leads to the uptake of FP. Then they have day-to-day experiences with contraception, and that may influence their behavior, which means they may continue using or they may desist using. And then the level of awareness of family planning policies, what the state is trying to communicate and how that is understood and inculcated into the household decision-making culture. And lastly, after the findings, I'll talk about some policy recommendations. So first of all, information sources. This is a descriptive finding, but a very interesting finding. What are the information sources of people about family planning? In places where there was a lady health worker program, many of the women were informed by lady health workers, but many were not. Those that were not informed, and in places where there was not a health worker program, it was basically the in-laws. Most of research shows in-laws as the people who want women to have more children, and they are also the primary source of their information about family planning. After that, it's female relatives, kinship networks, neighbors, community women. So these are all mediators. So all this information that the state is trying to push into households, into people's mindsets, is coming through social networks, is mediated through, is filtered through social networks. Men, on the other hand, do not discuss it very much in family. Their main sources are peers and friends, informal conversation, and their contact with health workers is very little. So a very few men actually talk to health workers. What they knew about family planning came from their friends, their peer network or whatever. So we have to cater to this role of social relationships or social filters that filter out information about family planning. I'm going to quickly move on to how contraception begins. So we asked people like, how did you start using contraception? And responses to those questions, I'm just going to focus on the key findings. Again, different pathways for men and different pathways for women. When women opted for contraception, it was almost always out of necessity. A bad pregnancy, multiple pregnancies, or multiple children, and after which they wanted to stop. It was usually their own, at their own volition, not at the volition of their husband or somebody else. They just felt themselves that they needed help. There's a very interesting quote here from this one woman. And this is a 40-year-old woman who said, I needed to take a break. Having children is easier said than done. It's like a woman loses her life in the process, right? So usually when they opt or start asking about contraception is when they've already had certain bad experiences. And their sources are usually not health people. Their sources are usually in-laws, their maternal family. That's what their primary sources are. Once even they get that information, they don't have direct access to family healthcare centers or health centers. They usually need some sort of facilitation. Either they need somebody's permission or they need somebody to take them there or just be there for social support. And usually, not surprisingly, it's not the husband, it's another woman. Lady healthcare worker programs or community health programs where they are working proactively, that actually works. Women do get proactively information from that program, so that's a good thing. excuse me about this. So men, on the other hand, their interest in contraception is very casual. They, if they want to know about contraception, it's not because of any need, just out of curiosity or out of frivolity, not any serious intent behind it. They have direct access to health facilities, but they are least interested in knowing about what their wives are going through or what family planning is and how it can affect their family. And lady health worker programs target specifically women. Men are not included in it, so they are also cut off from that source of information. I bring you one, you can't see that quotation. One person said, "We joke with each other." Everybody starts joking about the person who uses it meaning contraception. So it's almost as a frivolous joke among men. And I've seen that like 2-3 states of mind that men have. First is either they joke about it. Second, it's taboo. Third, it's the woman's responsibility. Like, so they dissociate themselves mentally from this. Once they start opting for contraception, again, women's experiences are very different from men's experiences. Women, unfortunately, end up with most of the intrusive methods of contraception, IUD, copper T, injections, which usually have...
interrupt you. It is your present is getting more and more interesting, but unfortunately, we have to conclude it in a couple of minutes, please.
Yes, sir. So if I was to say this, a lot of women who are a lot of the women who opt for these methods usually end up with bad consequences, side effects or method failure. But in the end, what really happens is the person who has put them on these methods has not informed them about side effects, and they are unprepared, and that's why they basically end up foregoing the method. Men, on the other hand, dissociate from themselves from this entire exercise. They consider this, and many men have said, as a woman's responsibility. Now I'll talk a little bit about agency. With all of this going on in the household, even though the woman is the sufferer and somebody who experiences all of this personally, her agency is negotiated. She either requires permission, she either fights for her rights, or she either just acquiesces. Right. On the other hand, men who want to dissociate from or at least mentally dissociate themselves from the idea of contraception, family planning, end up taking the decision. So there's certainly a lack of empathy. There's this quotation. I asked a woman talking about a man stopping to use contraception. I asked him about it. He said he just cannot do it anymore or cannot use this anymore. So it is just my husband's decision to stop using them. I had nothing to do with this or no say in this. So overall, what really needs to be done, I'm just going to take 1.5 minutes, hopefully, and finish my 3 key takeaways. See, we need, I think our idea was that we need a holistic approach that addresses 3 particular themes. We are not arguing for changing policy. I think the infrastructure policy is already there. The approach needs to change. An approach that caters to gendered experiences, which means separate campaign for men and separate for women, separate facilitation for women, especially who have less access. Secondly, household decision-making, putting programs into place that empower women in the household decision-making. And of course, giving people a practical understanding of family planning. The first about gendered pathways, I'm just going to skip the first 2. The first one is basically strengthening the outreach lady health worker program and expanding the role of male engagement. So there's a very good program going on in Mandi Bhaudin right now in which they are engaging men in this program. And I think that needs to be scaled up to the entire province of Punjab. What we did find could help is that social networks are really important. So I think the idea that lady health workers or some person from the state would organize community level groups where women can share such experiences with each other, because they learn a lot from each other is already happening. What we propose is do it in an organized way. Another key finding that we had is that a lot of women actually talk to the wives of the religious leader of that area. So if they are placed at a Maulvi, they would get advice from the Maulvis. Right? For some reason, she borrowed her husband's social capital in the community. So another idea is, Why not hire them as health workers? Why not train them as health workers? And imagine in a community where the religious leader's wife is a fertility health worker, imagine how it would break taboo and how it would break misnomers about religion and fertility. So that was one idea that we had. Secondly, how can we facilitate household decision making? First of all, premarital family planning counseling should be mandatory. Secondly, when somebody is put on a family planning method, that person should be given complete information on what the possible side effects could be and how to deal with those side effects. And there should be follow-up and visits for this. Another thing that I think we wanted to add was couple-focused messaging. All the messaging that we have seen about family planning does not really focus on the discussion side of couples. What really needs to change in the household is that discussion needs to start between husband and wife, that this is important and we do need to talk about this, rather than the man taking all the decision, the woman bearing all the consequences. So really a campaign that focuses on that, yes, couples need to discuss this, and the role of in-laws is inevitable. Every research shows that, our research shows that, and that would be, I'm just done, sir, just 10 more seconds. So why not include those people in the campaign, since they can play a positive role? In many cases, they have in our data set played a positive role. Last but not least, I think the campaign on the Tawazun campaign especially needs to be simplified. It needs to focus on three key areas that are WHO areas, that is family spacing, family size, and health, maternal child health. And that should be presented within the Tawazun framework. So the policy doesn't need to change, but the messaging and dissemination definitely needs to change. Thank you very much for this opportunity again.
Thanks a lot for very clear exposition of the mechanisms that are involved in FP services access. So our next guest is Dr. Akhtar Ali Sahab from NEST Islamabad. Please welcome.
Bismillahirrahmanirrahim. Good afternoon and very warm welcome to our presentation. This work has been completed in the guidance of Dr. Faisal, our HOD Sahab. He is sitting here, and also, my colleagues from NEST are here. So for me, it's like real honor and pleasure to present on behalf of Dr. Faisal Sahab. So, our work, like my earlier colleagues has presented, is really important work. Keeping in view the policy focus, we have tried to explore the impact of extreme climate change events on early childhood development in Pakistan. For that, actually, I will like to go through this outline. Briefly, I will touch the introduction, followed by gaps in existing literature and the need of this study, followed by conceptual framework we developed for this study specifically, and the methodology we adopted, the data set we used, and the models we employed for the analysis, followed by empirical analysis, and finally I will conclude with some policy recommendations. So, continuing, Pakistan is among the most vulnerable countries in the world. It's established fact, no doubt in this. And children are facing a lot of issues, like you can see high percentages of stunting and wasting in overall Pakistan and in different regions. And climate change has been explored on multiple ways, no doubt. It's a growing literature. But the missing link is that impact on early childhood development is somewhat missing, as we also found in our comprehensive literature review. And climate change is a major global health challenge. And extreme events like floods, heat waves, drought storms are occurring quite frequently. And young children 0 to 5 years are most vulnerable. So in early childhood development, we also focused on the children from 36 months to 59 months, 3 to 4 years of age, because this is the most growing age and the children are growing and they are getting ready for school. So in my methodology, I will be describing the 4 domains we used actually, and more insights I will be focusing more on there. So early exposure children early exposure actually leads them to lifelong development impacts. So it's really important that the early childhood development is not being affected by climate extreme events. So Pakistan is highly climate risk prone country. I will not go in detail, but what is really important is like health and nutrition. I mean, the children are affected by the extreme events like they face malnutrition, stunting, and disease. And also, I mean, like psychological stress, trauma, displacement, and maternal stress, as well as learning disruptions like school closures, child labor risks, as well as unsafe living conditions, poor sanitation, and overcrowding. So for this study specifically, I mean, why we carried out this study? What's the need? I mean, in Pakistan, there is limited specific evidence of extreme climate change, even on early childhood development. And second, children in poor regions face disproportionate risks. That's I will be coming more in the empirical results. And I mean, specifically with the objectives, we have tried to document the impact of extreme climate change events on early childhood development, as well as, I mean, inform child-focused climate resilient policies for information. So we have carried out systematic literature review. In fact, we reviewed more than 80 research studies globally, regionally, and specifically focusing Pakistan. And what we found actually, it was that there is a lot of work on nutrition, poverty, parental education, and so many different dimensions. But what's really missing is like impact of extreme climate change events on early childhood development. So the conceptual framework, I will not go in detail, keeping in view time, because I want to more focus on my empirical results. So it's like that extreme events affect child, like their physical development, psychological development, as well as their displacement, insecurity, all these combinedly leads to early childhood development. So specifically for this study, we have focused Punjab, Sindh, KP, Balochistan, and JB. We try to cover whole of Pakistan, and we used mixed data set. It's a comprehensive data set, as you know, and there is full module on early childhood development. So, and we actually constructed early childhood development index. So in next slide, I will be explaining briefly that how we actually constructed that index, and we use SPSS and data softwares, as well as, I mean, implying correlation, OLS, and probability analysis, and we complemented all this with some qualitative insights from all the 4 provinces. We have qualitative insights as well, specifically focusing that how climate extremes are actually impacting early childhood development. So,
Dr. Akhtar, please, would you like to conclude this in a couple of minutes?
Sure, I will very happily, I will conclude. So this is how we developed the index. Basically, it's like 4 key domains: literacy, numeracy, physical development, socio-emotional development, as well as learning approaches. So out of 4, if a child is good in 3, we assign 1, and if it is not, then 0. So how we actually develop this index, and specifically, I will, because of time, I will rush through the slides. My apology for it. We found that mother education has positive impact on early childhood development across all the 4 provinces for Pakistan, including GB. Specifically for Sindh province, we have this wealth quintile, and we found that poorest have lowest early childhood development, and as we move on, the richest have the highest early childhood development. So wealth is really positively correlated. Child-wise, male child, female child, we were not able to find any significant difference. So moving on, we have correlation analysis, and you can see that there is strong, negative, and significant correlation between rainfall, extreme rainfall, temperature, extreme temperature, and so on. So similarly, region-wise, across all the 4 provinces, including GB, is like negative and significant, and temperature, rainfall both. And OLS, like it's negative and significant at 10% level. Similarly, probability estimates like because of extreme events. So it's also negative and highly significant at 1% level, and for temperature and for rainfall both. So specifically focusing on key takeaways like mainstream climate resilience into early childhood early childhood development policies is the key, and we need to focus on mother education, girls education basically, and I mean the climate resilient infrastructure. Thank you so much for your time.
Thanks a lot, Dr. Akhtar, for your insightful presentation. Now our next guest is Dr. S.M. Nabilul Haq from Bhutan's Koita. May I request you, because we are running out of time?
Yes, I'll be very crisp. Okay, ji, Bismillah Rahman Rahim. Can you put the slides on? While the slides are coming, thank you, UNFPA. This was really very difficult task. It took a lot of efforts, a lot of time, especially Muqaddar is sitting here, Farha, Zahra, and Almas. Thank you, SDPI, for supporting us, Dr. Sajid, Aksa. So let's start with this. As you all know that the recent PBS statistics are telling that we have 7.1% unemployment in Pakistan. We have talked about, I was really overwhelmed when I came to know about the Youth Development Indicator, which is being prepared and launched in today's event. So our topic was very relevant, although it started 10 months ago, and it is about why skills and educations are out of alignment in Balochistan and empirical evidence. The purpose of this is to understand how and why educational and vocational mismatch contributes to unemployment and underutilized human capital in Balochistan. This is a Balochistan specific study. You can observe this map on your screens. This is NEET, neither in education nor in unemployment. And you can see the disparities are evident in front of you. Balochistan has the highest NEET in all of the Pakistan. Now, to make things very easier and less complicated, let's see what we have on the slides. This is telling us that we are youth dominant. 60% of the population is less than 30, as it is in overall Pakistan. Unemployment in Balochistan is highest, staggering 9.13%. Literacy rate is low, and extreme need is prevalent. That is around 42%, where the district of Shirani has the highest need, around 67.6%. So young people become an economic burden when educations and skill do not align with labor market needs. So we had to address this issue. These are the 4 points on which we have constructed our research work, and that was to look at the educational attainment, to look at the vocational skills, the job requirement, and employer expectations. Now, let's look at another thing, why this is harmful. This is harmful because this skill mismatch and mismatch after taking a lot of vocational trainings can misalign things. Higher education can lead to higher unemployment, and this is evident from our research. Underutilized human capital, job dissatisfaction, waste of public money in education is evident from our study. So again, we have to check the heterogeneities. We have used regional and gender disparities in our research, and the line at the end of the slides is saying something for this audience. And this is one of the important messages, key messages for the audience to take away. And that is, mismatch is not just an outcome, it is a driver of unemployment in Balochistan. So this is one of the things which is really important. I'll skip the research questions because time doesn't allow me. Coming to this is systematic mismatch, you can see that 34%, 34.7% in Balochistan are overeducated. 17% are undereducated, and only 48.3% are matched to the skills and the job requirement. So this is what is going on. We have analyzed TVETs, and we have observed by collecting data from them that the linkages are very weak. The curricula needs to be refreshed, and there is gender mobility constraint all over Balochistan. I'll be skipping the conceptual framework, and the framework of ORA is classified. O is overeducated, R is required, U is undereducated. We have constructed this using ISO 08 occupational coding and modal years of year education per occupation. And these are the internationally recognized standards which we have used to conduct the study. So coming to the data set, LFS 2021 were used, and subsequently we also collected data from a survey which was designed by us to the graduates of TVET centers in Balochistan, both from females and males. It was rich data. I'll be going to discuss about it. What we used, I don't want to go into the technicalities. Binary logistic regressions were used, ordered logistic regressions were used, and controls are written there. And we had restricted our sample just to Balochistan. So coming back to what we know, what is known to us. You can observe from this slide that overeducated individuals had significantly higher unemployment odds. Like growing horizontally, doing multiple MAs
May I
is not.
request you to please conclude?
Yes, I am concluding.
Running out of time.
Doing multiple MAs is not today's need. Rather, growing vertically may be something good for you. Okay, the TVET training reduces unemployment by 3.2%. If you have earned a certificate from TVET, there is a probability of 3.2% chance of getting employment if you are male, and 6.5 if you are female. Next is the most important is women in Balochistan are often underskilled and men in Balochistan are overskilled. So this is another dilemma. Another point is that part-time workers show higher underskilling. So part-time workers have relatively less skills as compared to full-time workers. Next is this one. Okay. Don't worry, this is my last slide. Okay, so what this narrative tells us, what youth has brought out in front of us as an evidence, is that they have lack of experience, curricula lacking industry relevance, few local job opportunities, low wages, employer bias towards degrees other than the skills they get from TVET. So degrees are still preferred as compared to TVET skills. Gender norm, women accessibility and mobility is a pertinent and ongoing issue in Balochistan. And the last one is the most important one. We don't have industry. We don't have professional networks that could earn jobs for the youth in Balochistan. So these are the policy implications of the study. You can just see: align TVET curricula with industry needs, expand apprenticeship and internship, improve career counseling and labor market information systems, strengthen employer engagement, address gender mobility, improve rural access to jobs and training. And this is our conclusion. We conclude that mismatch in Balochistan is widespread and it is systematic. overeducation and overskilling are not good. They are reducing employment chances in Balochistan. TVET helps only when aligned with job markets and requirements of the employers. Reforms must span education, TVET employers, and labor market. And last, youth is opportunity. We need to address this mismatch on emergency basis. Thank you. Thank you all.
Thanks, Dr. Nabil, for your very insightful presentation. Now, I would like to invite our last presenter, Dr. Muhammad Iqbal, Assistant Professor, University. Sayyid Farooq Shah? Yes, please.
जी जी So our study is about developing a climate vulnerability index, and our area of interest is Peshawar, because due to various climate stressors, so we focused on the Peshawar city. And in Peshawar city, we particularly focused on the underserved areas or underserved communities. And we feel that the Afghan households are the most underserved household in the area. So our sample is consisting of the Afghan underserved households. The purpose of the study was to develop a vulnerability index using the IPCC framework, which based on the three pillars of the exposure, sensitivity, and adaptive capacity, and to provide evidence for inclusive policy response. And this is a framework which is replicable for the other communities and other areas. We talk about the climate change, but there are a few studies on the vulnerability assessment. So that's why we choose this particular topic. And the objectives were to construct a composite household level index and to evaluate the responsiveness of the existing climate change policies and action plan of the KP province, and to provide evidence-based recommendation for inclusive climate resilience planning. The methodology we adopted was mixed. We selected households, and we also use some content analysis of the KP climate change policy and action plan. These were the tools we used. For the policy analysis methods, we used thematic content analysis, stakeholder mapping, policy coherence analysis, and smart evaluation. And the sample was chosen through non-probability technique, purposive sampling technique. The sample size was small, that was of 118 household, but that was due to the repartition of the Afghans. So we keep that in the considerations. There are three pillars of the IPCC framework, which was developed in 2011. And those includes the exposure, sensitivity, and adaptive capacity. After collection of the data, this one. We normalize the data because different variables were of the different range. For example, if you can look at the age, so age range from like 5 to 100. And then we have some binary responses. So for the index, we normalize that data so that every variable should fall in the range between 0 and 1. This was our normalization technique. Then this is the formula of the index which we adopted. And in this particular index, we use equal weighting scheme because this was the simplest one. There are other complicated methods available in the literature, like a PCA method and Duffy methods, but we just use the simplest one to reduce the bias. This is the demographic profile of the sample. We observed in the sample that the household, the total member in the household, which is the family size, is above the national level, and 21% of the households were headed by the female. In the housing and infrastructure data, we observed that most of the households were rented, and there was specifically mentioned in the Climate Action Plan 2022 that the KP government will install energy efficient street lights. So we just, for the effectiveness of that action plan, we also asked the household as there is street lights were installed or not. So 55% of the households reported that there were no street lights. When it comes to the house livelihood and income, then the primary source of the income was most for daily wages, laborers, and the majority, 76% of the household reported that they have practiced some kind of climate events. When it comes to climate perception, we observed that most of the Afghan households were aware of the climate concepts, because they were like we asked them that about the technical definition, so their perception were very much aligned with the technicalities. Impact of the household events. So all of the climate event had high impact on the underserved households. And when it comes specifically to the health impact, so we observed that which we usually miss this one, that the most reported impact was the psychological impacts, the stress and anxiety. The coping mechanism were very disturbing. The child labor was emerged as a coping strategy.
May I request you to please come in a
So
couple of minutes.
these are the main results. 48% of the households would fall into the moderately vulnerable categories, and 53% of the households were highly vulnerable, and none of the households fall into the low vulnerable category. When it comes to the determinants of the vulnerability, so we observed that household size and the composition of the gender, the number of female members in the household, and disability increase the vulnerability, and the safe drinking water sources and income stability decrease the vulnerability among the Afghan households. We all, as I mentioned, that we evaluated the key KP climate related documents, and these were the key gaps. Like there were absence of equity focus, weak gender mainstreaming, no monitoring framework is there, limited financing clarity, and limited social vulnerability lens, and underserved areas or slums are not mentioned in these documents. These are main of the recommendations, but I will just focus on the last one. For example, if we can rationalize the disaster risk committees at these underserved areas or for these underserved communities. So, and then there must be some implement third-party monitoring and annual progress review to improve accountability and public trust. So these are the main recommendations of the study. And on the applicability side, so we have been approached by the NDMA, and we are collaborating with them, and we are extending this index to other KP areas. At this stage, we are focusing on Mardan and Nowshera and Charsadda. So we are developing the similar indexes for those regions also. Thank you.
Thanks a lot. We are done with our presenters. Now, this is time for us to have a few questions because we are already running out of time. I would request you to just ask very direct questions, and you might like to suggest which presenter your question is directed at, and please go ahead. Please. Mike, इनको दे दें. वालेकुम अस्सलाम.
Hello, my name is Tahir Wazir. Basically, I am from Waziristan, and currently I am doing bachelor from Namal University, Islamabad, Government Public Policy. My question from Ma'am Roj. Ma'am, already I have a research on this topic, the female barriers in culture. So हम देखते हैं मोस्टली हमारे जो इलाका है, एक तो वहाँ पे कल्चर बैरियर्स बहुत है, दूसरा है ना एथनिक जो बैरियर है ना वो होते हैं. पब्लिश करने के बाद है ना मैंने काफी है ना रिलीजियस और एथनिक बाकी कल्चर है ना बैरियर्स वो जो थे ना वो मुझे वो मतलब क्रिटिसाइज इसने मुझे किए. तो इसी
could you please make your question very direct?
So, how we can handle this culture barriers? How we can tackle this culture barriers in way in your research base?
Okay, we might like to have one more question, please. Any other question? Okay, Ji, Aruj.
So basically what we recommend in the report is that cultural barriers are probably the hardest and the kind of barriers that take the longest to overcome. So what we suggest in the report is to create work from home opportunities for women, because it's going to take a lot of time to change the mindsets of people. So what can be done in the short run is to create opportunities for women within households to be able to generate incomes. For example, they can do stitching, they can do cooking, baking, all of these things can be done from within their households. And a lot of women are doing it. So what we suggest, what we recommend in our reports is that these women can be given some sort of seed money or capital to sort of grow their business and operate from within their households. And in the longer run, we can work on awareness and sort of trying to overcome these cultural barriers.
Okay, thanks a lot. Okay, coming down to the end of our session, I would like to invite our chief guest of the session, Muhammad Ali Talpur, Joint Chief Economist, Ministry of Planning, Development and Special Initiatives. Please, sir, welcome and have your.
Distinguished researchers, honorable participants, Assalamu alaikum and very good evening. Thank you very much, SDPI. Thank you very much, UNFPA, for providing me opportunity to share my views with you. Thank you very much, the honorable researchers. Your valuable thoughts are have a meaning for us, especially in the Planning Commission. All your research is reflected in our planning, in the PC1s, and it has a worth for us, especially for the Planning Commission. So if I conclude from all of your papers, from your research work, that now there is a specialization in every work. And in terms of the interventions, in terms of project management, you also need some specialization. There is no time for the generalizations now. So even the dynamics of the population, as you mentioned through your research, that it now needs some specific interventions, even at the province level, national level, or at the district level, because the dynamics are quite different. So The Planning Commission of Pakistan is quite aware, and we have incorporated most of these ideas, these thoughts in our planning and management work. Let me share some of the points with you all that how the Planning Commission has planned and how they are we are working. We have planned our short-term, medium-term, and long-term plans, and how the data has a meaning for us. Regarding Udan Pakistan framework, it, as you know, it contains, it is based on the 5 E's, and the 5 E's come from the exports, from the e-commerce, from energy, from other two components. And for all these 5 E's, we concentrated, we focused on the data. That the data is the only support pass for us, the data, the evidence-based data. So that was the main crux of our planning, and we completely halved the data in our planning, and making the Udan Pakistan framework for the Pakistan as our long-term vision. Now the data is the foundation for the Udan Pakistan. Now the sustainable development has been made the part of our all development projects. Every PC1 now contains the SDGs alignment. Simultaneously, we also review our overall planning portfolio at the annual plan level, at the 13th 5-year plan level, and the long-term Udan Pakistan 5-year. So again, it is through data. So this is again, I'm talking about the significance of the data. So again, we also see resilience in our planning in terms of the climate change, especially. We focus on our infrastructure, which is being carried out through Planning Commission. We ensure the resilience in terms of the climate change and ensure that data. Employment generation is also our main focus in the all the PCOs, and it is evident from all our appraisal systems. If you see our documents, that we ensure the employment generation through these projects, so that there should be a concrete output of these projects. So the final word is that as you emphasize on the data, that message has reached the Planning Commission, and all the planning is through being done through the by focusing on the data. So with this, thank you very much. As you have already less time, for you are about to finish. Thank you very much, everyone. Thank you.
Okay, and now we are ready for the launch of working papers and research reports, and the group photo and some takeaways. Huh? Group photo? Ji sir, please, group photo, sir. Thanks a lot. Thanks a lot, and this concludes our session. Thanks a lot.